Patients with neurological conditions, such as stroke and spinal cord injuries, may have weaknesses in their limbs that can limit their mobility. They may require assistance from their caregivers to do basic movements such as turning in bed and transferring out into a chair. It is important that the caregivers are able to perform these transfer techniques safely to minimize injuries to themselves or the patient. The use of a hoist is recommended to transfer patients who are fully dependent or require maximal assistance. Using a hoist reduces the stress on caregivers that may occur during lifting. It also reduces the number of persons required to transfer the patient. A hoist is a machine that comes with a sling that helps to transfer patients in and out of bed. There are many different types of hoists, such as the ceiling and the portable hoist. Portable hoists have similar mechanisms and parts. Make sure you familiarize yourself with the parts and have undergone training with the manufacturer or the therapist prior to transferring the patient. The common parts are base and vertical frame of the hoist, lifting arm, spreader bar, loop attachment points for the slings, legs that can be widened to get around furniture, foot pedal, front casters, rear casters with brakes, steering hand grips, motor, battery pack, stop and reset buttons, control handsets, dual up and down buttons, system failure lowering override. This hoist is recommended by the manufacturer to be used with 2 persons assisting the patient. Please check with the hoist manufacturer for further clarifications. After familiarizing with the parts, always do the following preliminary checks to ensure safe usage. Check the maximum weight allowed on the hoist machine. Check the sling for damages. Check that the battery is in place and fully charged. Plan the transfer and prepare the environment to make sure that there is enough space for the hoist to maneuver. To begin the transfer, the sling needs to be placed under the patient. Position yourself so that each of you are on one side of the bed. We will first roll the patient to one side. Ensure that the patient bring her affected arm across using the other arm and assist the patient to bend the weaker leg. Stabilize the patient by placing your hands on his hip and shoulder blade. On the count of 3, roll the patient. Place the sling lengthwise along the patient's back. Fold the sling halfway and ensure that the top of the sling is in line with the patient's head. Roll the patient to the opposite side. Ensure that the sling is in the center of the patient. Once the sling is in place, move the hoist machine to the side of the bed. Lower the spreader bar and attach the straps at the corner of each sling to the bar. Left-sided upper straps should be hooked to the left side of the bar. Likewise for the right side. The lower straps should be crossed over each other before hooking them to the bar. Once the straps are all hooked on safely, explain to the patient that she is going to be lifted up. As advised by this hoist manufacturer, do not apply the brakes. Ensure that one person is with the patient while the other person is controlling the hoist. Use the handset and raise the patient slightly off the bed. One person assists in guiding the patient, while the other controls the hoist to transfer the patient to the chair. The legs of the hoist can be opened to fit around the chair if necessary. Lower the patient slowly to a seated position. As the patient is being lowered, guide the patient so that the buttocks is far back into the seat as possible. Release the tension on the sling by lowering the spreader bar and remove the straps of the sling. To remove the sling, lift the patient's thigh one at a time and slide away each leg part. Lean the patient forward and remove the sling from the back of the patient. To position the patient right back into the chair, lean the patient to one side, guide the opposite buttock backwards, and repeat on the opposite side. To transfer the patient back to bed, the sling needs to be placed behind the patient. The patient is asked to lean forward and the sling is placed behind her back. The lower straps are placed by lifting each thigh one at a time. Once the sling is in place, push the hoist towards the patient with the spreader bar lowered. Cross the lower straps before hooking them to the loop attachments. Raise the patient up and move the hoist to the bed. Position the patient to the center of the bed and lower the patient. Release the tension of the straps and unhook them. To remove the sling, roll the patient to the side. Assist the patient to bend the lower leg. In order to assist the patient, one has to hold her at the hip and the shoulder blade. On the count of 3, roll the patient. When the patient is on her side, fold the sling halfway. Roll the patient to the opposite side and retrieve the rest of the sling. Lifting or carrying patients who require maximal assistance could potentially cause musculoskeletal injuries to yourselves. I hope this video has provided you with an alternative method to transfer your loved ones safely. Always check with your manufacturers if you have any questions with regards to the hoist. Thank you and goodbye.